Welcome to the first lecture in this course. This lecture is going to be on autism, a brief history of treatment, and a little information on medication. First, regarding treatment history for individuals with autism. Now, in the 1940s, uh, Leo Kanner and Hans Asperger identified autism. In the 1950s and 1960s, Bruno Benelheim was one of the major theorists who was involved in treating individuals with autism. And he came up with the now disproved theory of the refrigerator mother, that autism was caused by uh, mothers who were very cold and uncaring to their children, and children were actually at that point removed from their parents. Over time, this came to be seen as incorrect. Bernard Rimland did a lot to disprove that theory. And in the 1960s, we began to see some effective treatments emerging. Specifically, applied behavior analysis was when ABA started to be being used with individuals with autism. At the same time, in the 60s, we also saw a continuation of treatments that were less efficacious, including LSD being used to treat individuals with autism. In the 70s, was when Teach was developed. Teach is a evidence-based practice that is still in use today and has shown very efficacious use for individuals with autism. Some of the treatments that were used at that time that were more alternative, less efficacious, and somewhat dangerous was the use of electroshock therapy, and punishment was strongly used. Even as part of ABA programs, you often saw a punishment component. In the 1980s, this was a time where we saw the prevalence of autism begin its rise. Uh, Still, it was 4 in 10,000 at that time, but it had gone from 1 in 10,000 to about 4 in 10,000. And so we saw more treatments being developed, including discrete trial training, which is an evidence based practice with a strong efficacy background, floor time, incidental training, PEC, social stories, sensory integration. These are all treatments that were developed in the 1980s and 1990s that have a strong evidence base, continue to be used today, and are efficacious. That was also a time when ABA was still in use, but positive behavior support started being involved, and punishment became less and less accepted as a means to work with and treat individuals with autism. The 1980s and 1990s also had some treatments that were maybe less efficacious, that research doesn't support their use, although there may be some individuals for whom they did show some effectiveness. Those include biochemical interventions, for example, diet, special diets, audio integration therapy, holding therapy, and facilitative communication are therapies that are quite controversial and have been shown to have some potential harmful effects, um, although they are sometimes still in use today. They do not have a strong evidence base behind them. In 2000, we saw even more treatments. The treatments that were already in practice that had an evidence base began to get stronger, and tweaks were made to make them even more powerful. So the ABA of today is different than the ABA of yesterday, but it is still an evidence-based practice. Pivotal response training was developed in the early 2000s, cognitive scripts, and again, we saw some practices that were alternative and somewhat dangerous, including chelation therapy, which has been proven to be actually quite harmful, and the NIH actually stopped a study because of the harmful effects of chelation therapy, and hyperbaric oxygen chambers. So we see more alternative treatments as the prevalence of autism rises and more people are looking for ways to treat it. Many individuals with autism are on medication, and so if you're working with individuals with autism, it is important that you understand some of the medications that they're on and how medication works with individuals with autism. You'll always want to make sure that you speak to the parents or the individual themselves to know what medication they're on, and to understand what the side effects of those are, so that when you're doing interventions with individuals, you can take the effects of those medication into account. It's really important to do so. Some of the reasons for medicating students with autism include behavioral problems. It's probably the most common. Those are often treated with antipsychotics, things like risperidol, which is FDA approved to treat autism. You'll also see some off-label use of things like Haldol and other psychotropic antipsychotic medications. Anxiety and depression is often treated with SSRIs, which are things like Prozac and Zoloft. Seizures are not uncommon in individuals with autism, and you'll see those treated with anticonvulsants like Tregatrol, maybe even Depakote. And inattention and hyperactivity often occurs comorbidly with autism, and those are treated with stimulant medications like Ritalin and Adderall. Medication use with individuals with autism presently is quite high, and actually more than 50% of students with healthcare needs and autism used at least one psychotropic medication. 33% are using stimulant medications, 25% are using anti anxiety or mood stabilizing medications, and 20% are using antidepressants. So, as you can see, there is a high rate, and it is important for you to know if the individuals you're working with are on any medications. Um, Also, we're also seeing a rise in multi-drug treatment used with individuals with autism. So about 35% are using two or more classes and 15% are using three or more classes, so three or more different kinds of medication, psychotropic meds at once. Um, Usually older children and those with evidence of co-occurring conditions like seizures or ADD have higher odds of using those psychotropic meds. The thing to be aware of is that there's actually, at this time, little evidence of the effectiveness or appropriateness of multi drug treatment of autism. And so while it's currently being used quite a lot, it is something to be aware of that the evidence base has not gotten there yet, although research is being done. And so you want to look at that use very carefully. And you also want to make sure that you understand what the possible side effects of those combinations are.